Hi, my name is Laura Huppert. I'm here at ASCO 2023, and I'm presenting this poster, a phase 1b study of T-VEC in combination with chemotherapy or endocrine therapy for patients with metastatic or unresectable HER2-negative breast cancer. So by way of brief background, some patients who have metastatic breast cancer get lesions on their breast or skin or chest wall, which can be very morbid for these patients. So we really need better therapies for these patients in particular. So one hypothesis is that we could inject T-VEC, which is a modified oncolytic herpes virus, into the chest wall lesions and give it in combination with a systemic therapy to improve the immune activation locally and potentially even stimulate a systemic immune response. And so that's what the purpose of this study was. And so in this study, we enrolled 19 patients who had triple negative or ER positive breast cancer and injected T-VEC in combination with chemotherapy or endocrine therapy and observed both their local response in skin and their systemic response. And the brief takeaway is that we did see that this combination was safe. Most patients tolerated it pretty well, with some patients having a fever or some chills after the injection. But otherwise, most of the safety profile was consistent with side effects that are typical from chemotherapy. And in terms of efficacy, we did observe several partial responses in stable disease. So 2 patients had a partial response and 6 patients had stable disease on this therapy. And a greater number of patients had response in skin, even if they didn't have systemic response. The last piece that I think is really exciting is in this trial, we took treated and untreated tumor biopsies before and after treatment, and we're able to look at the tissue and systemic response in collaboration with Larry Fong's lab and Mike Campbell's lab at UCSF. And we observed that the lesions with higher pre-treatment percentages of CD8 positive T cells had a trend towards improved local response. And we also observed peripheral changes as well. So I think the takeaway here is that this combination seems to be safe and tolerable. And we're hoping to really learn a lot from these translational analyses as well in the future.